In the past few weeks, North Carolina lawmakers passed new abortion restrictions and advanced measures to remake UNC Health Systems and Blue Cross Blue Shield of North Carolina. These are sweeping changes for two of the most important healthcare entities in this state. The General Assembly also voted this session to expand Medicaid. That's a massive multi-billion-dollar program, and it would provide hundreds of thousands of uninsured people with health insurance paid for by the taxpayers. This is shaping up to be a massive legislative session for healthcare. And that's our deep dive conversation today on the Daily Download. I'm Travis Fain, and we have a special guest, Rose Hoban, who runs NC Health News, a site dedicated to this sort of policy coverage. Welcome, Rose.
Thanks. Hi, Travis.
So I want to start with some of the big pieces in this puzzle, and then we can kind of talk about the picture they create together, what healthcare is going to look like for people as these major changes take effect. The Blue Cross bill. So it sets up a new parent company for the state's biggest insurer. They can move assets into it, and it frees them up, this structure, to buy other companies without all the scrutiny from state regulators that Blue Cross would otherwise face. So, Rose, why does the company want this, and what's their end game here?
Well, I mean, it's what they're saying, and we've heard the words over and over. They want to be more nimble. They want to be more flexible. They want to compete. So that's what they're saying. What they really want, it's harder to discern because that's not been forthcoming from them. You know, like they want to be more flexible. Okay, flexible to do what? And so to get a sense of that answer, it's sort of useful to look outside of North Carolina at what's happening in insurance world writ large. And one of the things that's been happening with other insurers in other states is something called vertical integration, where health insurance entities are buying up medical providers. I mean, the first big example of that is, say, Aetna and CVS. Interestingly, you would think that Aetna is a big insurance company and they bought CVS. Well, no, CVS bought Aetna.
So the pharmacy bought the insurance company. But this is the kind of thing Blue Cross wants to compete with.
Right, exactly. Another example of that is United Healthcare, based in Minnesota. They have bought a pharmacy benefits manager called Optum. And when you look at the balance sheets of these companies, these combined companies now, it's the pharmacy parts that are bringing in more money now than the insurance. And that's because what they're doing is you kind of keep more dollars in-house, right? Like your insurance is United. United says, go to Dr. Fain. You go to Dr. Fain. Dr. Fain sends you to, an Optum-supported pharmacy. You spend your money at Optum. Then United is reimbursing Optum, so that money is staying in-house. The big win is if United has bought Dr. Fain's practice. Right. And so all those dollars kind of stay in-house. It's called vertical integration. The big example, if anyone's ever spent time on the West Coast, is Kaiser Permanente, which is a huge vertical integrated company on the West Coast, California, Washington, Oregon, and they are everything. They're the insurer and they are the medical provider. They have their own hospitals. And, to the insurer's credit, places like Kaiser Permanente have been able to do some really interesting work around driving value rather than just like having doctors do piecework and order 16 tests because they'll get a cut for each test that they order and bill for each test that they order. Instead, they can push their physicians, who are employees, by the way, they can push their physicians to give us better value. So don't just order 16 tests, order the 3 tests that are really going to tell us something. I lived in California when I went to graduate school. So there's less replication of services. So, for example, I had a friend in California needed to have a particular type of scan. And it was a treatment. And so I drove him up to Sacramento because that was where the machine was. Right. So, there's less of that kind of replication where every hospital has to have an MRI and every hospital has to have, a gamma knife, which was this particular thing. and which are expensive, and it drives up costs.
So it's kind of a form of monopolization, but it doesn't necessarily increase costs. Is that kind of a fair way to think of it?
Yeah, it doesn't necessarily increase costs, and the Kaiser folks would argue that it actually decreases costs. One of the things, though, has been my graduate work. I researched nursing issues, and so if you talk to nurses in the Kaiser system, it's because they're such a big player, it's helped to depress nursing salaries,
wages,
right?
yeah.
And that has been something that's been shown when you see hospital consolidation, at least, like when all the hospitals in a city are owned by the same entity. You can't say, well, gee, I'm not getting a fair shake at, hospital A. I'm going to go down the street and go to hospital B and make a little more money. Well, if hospital A and hospital B are all owned by ABC Corp, you can't get that extra dough.
It makes sense. And I know a lot of people maybe listen to this work for UNC Health. We're going to talk about a bill moving that would impact them specifically and impact healthcare broader. But we're going to do that on the other side of this break. Stick with us. Rose Hoban with North Carolina Health News. We will be right back. All right, we're back on the Daily Download with Rose Hoban from North Carolina Health News, talking about major bills that are going to change the way healthcare is provided in some ways in this state. UNC Health, okay, that's a major hospital system. They've got a bill that they want. It's different, but it's kind of along the same lines of what we were talking about with the Blue Cross bill. UNC Health, it's a state entity. It's tied to the university system, obviously, but the bill would make that more explicit. Clearly dubbing it a state agency, using those words, so that it can get around federal antitrust laws. Now, Rose, why is that important?
Well, let me say it would make it more of a state agency and not more of a state agency, because the 40,000 workers at UNC, suddenly they would not be getting the after November, right? Like the folks who've been there already, they'll be able to keep like their state benefits.
So new hires, we're talking about new hires.
New hires, right? Like so. So the status of these workers is not completely clear when you read the bill. Like they're no longer getting the North Carolina state retirement plan. They're no longer getting the state health plan for state workers. It's their health insurance. And so that's kind of interesting, but it doesn't say that they're no longer state employees. I think it gives the system a certain amount of independence, even as it becomes this, quote, state entity. I'm making quote marks in the air. And what that allows to have happen is that they can be exempted from antitrust provisions. It turns out that there was a Supreme Court case around this in Georgia, and it was Phoebe Putney Hospital, and it was looking to merge. And the state lawmakers there gave it permission, but they did not explicitly state in their bill that Phoebe Putney would be exempt from antitrust, from federal antitrust. And it turns out that if you are a state agent, state lawmakers can actually exempt you from federal antitrust provisions, which kind of blew my mind when I first learned about it.
And the sort of antitrust rules we're talking about is like two hospitals talking to each other and saying, well, here's what we charge for this, and here's how we do this. And as we merge, basically anti-competitive conversations can't happen until they can.
Right. And, what's been interesting, again, context is everything. So what's been happening over, the data over the past 20 years are becoming really clear. And that is that when you have hospital competition, that it keeps prices down. When you have consolidation, especially in one market, those prices, there's nothing to keep them down, so they start to rise. It turns out North Carolina is pretty darn consolidated already. I was talking to this one national health economist, and he was like, well, Charlotte is, consolidated. And I said, well, what about with Atrium? And I said, well, what about Novant Health? And he said, yeah, they're a bit player compared to Atrium. Atrium really is the 800-pound gorilla, and they are calling the shots in Charlotte. And, in the Triangle, we're used to having several systems that compete, Duke, UNC, Wake Med. But in other parts of the state, there's only one game in town. So, you're not going to say, well, gee, I don't like the price on this, and I'm going to ride an ambulance for 3 hours to go get like a slightly lower price. No, people are stuck there, right? So what's happened as hospitals have consolidated? I'm sorry this is running long, but the Federal Trade Commission, which oversees this kind of stuff, when I first started thinking about hospital consolidation back, remember when there was that big food fight between Rex and Wake Med, maybe like 12 years ago? And I started talking to health economists, and they were like, the data are coming back. This consolidation's going to be bad. And the Federal Trade Commission had pretty much given a green light for hospitals to consolidate in a lot of markets, and they've been that way. And but in the past 5 or 6 years, the FTC is going, oh, wait, no. Oh, no.
Maybe we need to
slow
rethink
this. Yeah, and they've been challenging more hospital consolidation plans in different parts of the country, in Chicago, and is one of them. There was one in St. Louis that they contested. So this indemnification against federal antitrust rules is really a maneuver to get around the Federal Trade Commission.
Yeah, and what lawmakers pushing the bill say is that they want UNC Health to be able to save rural hospitals that are struggling. But, I mean, it's not like the bill says rural hospitals in it. It is broader than that. And to my knowledge, UNC Health hasn't said what they want to buy or merge with or work with, right?
What they've said is that that this bill affirms that they're the state's medical system. They're the state's healthcare system. And I'll make this point. UNC has been able to both acquire and set up management contracts with a number of failing rural hospitals, everywhere from Siler City to Hendersonville to Lenoir, at Lenoir in the eastern part of the state, not Lenoir County, but Lenoir, the town, Wilson. So they've really, Rockingham, right? So they've really taken over a lot of these hospitals. No one's ever said, oh, well, hey, this is not okay, because they're far-flung. So, it's not like anyone is stopping them now. I don't know what they need. They feel like they need this antitrust protection for.
So last week, an abortion bill passed very quickly, the North Carolina General Assembly. Now, we dedicated another show to that, so we don't have to get into the ins and outs of it. But I'm kind of wanting us to connect all these dots here to the extent that they connect. You got the UNC bill, you got the Blue Cross bill, the abortion bill that passed that'll further restrict abortion in North Carolina. I mentioned at the top of the show Medicaid expansion. I mean, that's going to be health insurance for the working poor, essentially, right, Rose?
Right, yeah. And it's and that Medicaid expansion, you said it's paid for by taxpayers, but it's paid for by federal taxpayers for the most part.
That's right. And what I'm wondering is, you put all this together. Have you seen a legislative session with more impact on the healthcare industry than this one? I mean, this just seems to be a lot of major pieces moving around the board.
I mean, the next closest year we could think of would be 2015, when the legislature passed a bill ordering the state's Medicaid program to become managed care, but that it's not nearly as sweeping as all of this. Like getting Medicaid to managed care was a very big difference. And I mean, that's a whole other story. That's
right.
Like the fact that, we had one of the most efficient Medicaid programs in the country. There was this, sort of a diatribe about Medicaid being broken, but when you deliberately underfund it in your state budget, of course it's going to come in over budget. And so then, what you do is you privatize it. So what it's doing is moving a lot of these public dollars able to flow more into private hands.
And so writ large, we've got new abortion restrictions.
Mm-hmm.
We've got more federal money flowing into the hospital system.
Absolutely.
It's not just these people get insurance, which is hugely important for them,
Mm-hmm.
but it's also big for hospitals and doctors' offices around the state who are all of a sudden going to have more paying customers.
And remember, because we did Medicaid managed care and we're accepting this federal, and I wish it's HASP, H-A-S-P. It's the
Hospital Access Stabilization Program. And so what it does is it changes. Before HASP, there's been this DISH payments, which hospitals get these disproportionate share hospital
payments, like if you're a hospital in a poor part of the state and you have a lot of uninsured or a lot of Medicaid patients, you get these enhanced rates, right? HASP replaces DISH payments, and HASP brings in more dollars than DISH payments did. So the hospitals, a lot of these hospitals, like I'm not worried about the Atriums and the Dukes and the UNCs for that matter in North Carolina. I'm worried about like the Appalachian Regional Healthcare System, up in the northwestern corner of the state. I would say I'd be worried about Vidant, and Vidant, which basically covers 26 counties in the eastern part of the state. They've had to close clinics and cut staff because so many of their patients are either uninsured or uninsured, period. And a lot of them have Medicaid as well, but so many are uninsured. So now with Medicaid expansion and HASP, it'll make that system stronger, right? But it's the smaller, less well-heeled systems, but there are fewer of them now, right? Like Iredell Regional Health, right? Like it's a 3-hospital system in like Iredell County. Like these systems have really struggled. The Cone people would tell you in Greensboro, yeah. So they're Greensboro and Alamance County, and they'll tell you that they feel very much the pressure of these large systems around them. And then Cone tried to merge with a system that's based in Virginia called Centara. And then when push came to shove, the Cone people will tell you that Centara really saw it as a takeover. And the Cone people didn't want to be taken over. They wanted to merge. They wanted to have an equal partnership. So they pulled out of that deal. But they've been looking for a safe harbor.
Yeah, a lot of big pieces moving on the chessboard. I think that's one of the reasons it's important to check out Rose and her team at northcarolinahealthnews.org. Healthcare is complicated, and they break it down. Thanks for checking us out, Rose. Thank you for your time.
Oh, you're welcome. This has been fun.
If you enjoy the daily download, rate us, review us. Another great way to get WRAL news in the morning is Morning Briefing Newsletter. It's a daily email. It's waiting for you, I should say, in your inbox every morning with Triangle News, events, headlines. Get you ready for your day. Sign up at WRAL.com/newsletter. Thanks for listening.